Okay, so what are we doing?
Hey Lisa.
Hi.
How are you?
Good.
So we've kind of been talking about this for the last year or so.
2 years.
2 years? So what brings you here today?
Well, after interviewing all of your patients for your YouTube video, I just now I know for sure I want to do it. I mean, I just feel so comfortable and confident. Everybody's so happy and there's no pain and it just seems like easy. And that was my biggest fear is, what's the surgery going to be like? What am I going to look like? Am I going to be happy after? I've been contemplating it for like 5 years, but I just wasn't sure. And now, just after interviewing all your patients, I know that I'm ready.
It's not as bad as you thought.
No.
Okay, so I reviewed your medical history.
Okay.
And you're healthy. You're a good candidate for the surgery. You know that we do it here. It's under general anesthesia. Our anesthesiologists are all board certified doctors. Surgery takes about an hour. It's outpatient. After the surgery, you recover for about an hour, and then you go home. And I'll usually see you the next day. So we need to talk about the different implant types and sizes and that sort of thing.
Okay.
So there's basically saline implants and silicone implants. They're both equally safe.
What's the main difference?
There's a few differences. The main difference is really the feel.
Okay.
So this is a silicone implant.
Okay.
This is a saline implant.
Okay. This one feels better.
Right. The silicone feels more natural.
Right.
Saline are a little firmer. And this one's red, just, it's got food coloring in it, but obviously it'll just be clear salt water when it's placed inside you.
Okay.
So this feels a little bit more natural, and then depending on the size you go, it may look more natural. These are more expensive. They cost about $1,000 more.
Okay.
Then there's a few other differences. The saline tend to have more rippling. So you can see the wrinkles on the side here, whereas you don't really see that here. So if you don't have a lot of breast tissue and fat to cover the implant, you may see this, especially on the outer part, usually on this part of the breast.
Okay.
You'd see that less with silicone.
Okay.
Another difference is at some point they may rupture. There's about a 1% chance per year that they can rupture. If the saline rupture, the water leaks out, your body absorbs it, and your breast will shrink. And it might take a week or 2 weeks and you'll know that it broke. With silicone, nothing may change. We call them silent ruptures.
Okay.
They're going to feel the same, it's not going to hurt, and the silicone really doesn't leak anywhere. So the only way to know if this broke is to get an MRI, other than actually having the surgery to look at it. So they do recommend periodic MRIs for silicone implants.
Okay.
So that's one disadvantage of the silicone is you don't know if it broke.
Okay.
Now realistically it's probably going to last a long time, but there's a few percentage that may break, within a few years. As you can see, they come in all different sizes, so we're just going from smaller to larger. You said you wanted to be, maybe a small C, which most women typically want to be in the C range, small C to full C. Occasionally, if they're really small, they may want to be a B cup, and some women may go to a D cup, but I'd say the vast majority go to a C cup. And so the average size is probably somewhere around 350 to 400 cc's, which is, something about this size, which is a little bit bigger, and then this size is the next size up.
Okay.
So these are probably the most common sizes that we use for silicone.
Okay.
And obviously saline come in the same sizes. Now the other difference is that with silicone, they come like this. They already come sealed and full, whereas the saline implant comes empty. So the incision to put it in for silicone has to be a little bit larger than with saline, which means a little bit longer scar.
Okay. Like how big?
With saline, you're talking about 3 centimeters, and with silicone it can be anywhere 4 to 5 centimeters. It's not a huge difference, but it's a little bit of a difference. Then the other thing we have to talk about is where we're going to make the incision. Most commonly it's done underneath the breast in the breast fold. Second most common is in the areola, and much less common is in the underarm or in the belly button. Personally, I don't do the belly button procedure.
I don't know that one.
Yeah.
I think underneath.
So underneath, certainly when you're standing up, the scar is hidden because the breast basically covers it. And the way I do the surgery, the scar heals very well, and you can barely see it. You know, after a few months, it fades to a white color.
Okay.
You can resume most normal activities within a couple of days. I would just tell you not to exercise for a few weeks, between 2 to 4 weeks. Same with no heavy lifting. But you'll be raising your arms up the night of the surgery. You can drive within a couple of days. You're not going to have a lot of pain, just the way I do the surgery. There's very little pain, there's very little swelling, there's very little bruising.
That's amazing.
Yeah, it's just...
Is it a technique that you do?
Yeah, it's a little bit of a different technique that I use. It has to do with, there's a few factors really. The anesthesia that I use before I start the surgery, I put local anesthesia around the breast. The type of anesthesia the anesthesiologist uses, we do general anesthesia, but even the medications they use help with pain afterwards. And then the most important thing is just the technique. It's a very atraumatic technique so that you literally barely lose a drop of blood throughout the surgery, and there's just not a lot of pain afterwards. Other surgeons do it differently. They may be a little more traumatic to the tissues, which makes you bleed more, makes you swell more, makes you have a lot more pain. So it's just a different technique that I've developed over the last 10 years or so of doing this, and the vast majority of patients have no pain. Now you will feel a little bit of tightness. You'll know you had something done, but it's really not bad. I mean, most patients tell me if they worked out too hard, that hurts worse than actually having the surgery.
Okay.
Any other questions?
The only couple questions. I do yoga, so you said 1 to 2 weeks. I mean, yoga's a little, a lot of stretching and back bends and.
Yeah, stretching is not really a problem.
Okay.
It's just I wouldn't do exercises that put a lot of pressure on your chest muscles, or that use your chest muscles very much. So you may have to modify some things.
Okay.
But that, it's only for a couple of weeks.
Okay.
What else?
I think
We do give you medications to take afterwards, including pain medication. A lot of patients, they take it the first day because they think they're supposed to, and then after a day or two they realize they're not in any pain, so they stop taking them.
Okay.
But we do give them to you just in case,
Okay.
along with a few other medications that we'll go over.
Okay.
We do have to get some blood work beforehand and an electrocardiogram just to make sure, everything's fine. Obviously safety is, the most important thing. The anesthesiologists we have are all excellent. They're all board certified.
Oh, right. I was going to ask about the anesthesiologist because I've never gone under before, so that part kind of scares me.
The anesthesiologists that I use actually come from Holy Cross Hospital, which is nearby. I've been using the same 5 or so anesthesiologists for the last 10 years.
Okay.
They all have a lot of experience, not only with cosmetic surgery. I mean, they do heart surgeries and major surgeries, so they're really overqualified.
Oh, good.
And we've never had a problem here.
Okay.
So, if God forbid something happened, we do have Broward General close by. We've never had to take any patient there afterwards, but it's it's there in case we need it. I do have privileges there,
Okay.
so that wouldn't be a problem. But the chances are so small that anything bad could happen.
Okay. I'm excited.
Okay, so we'll look over some pictures and we'll finalize the size, and then we'll be ready to go.
Okay, good.